We've been watching and observing the qualitative improvement in patients' care related to this model. And I should tell you that historically it started just with outreach navigation, and this is back in 2009. And we implemented some enhanced outreach techniques in order to get patients that were identified as injection drug users, and they were going to addiction medicine programs. And at this time we didn't have this service in our clinic, so we relied heavily on the outreach navigators to work with these individuals in order to connect them to care. So what we've identified is that we started off in 2000, I guess I'll go to 2017, and we noticed that the gap in care, so this is the 6-month window period between the first visit and then at the end of the year, they did not have another appointment scheduled for over a 6-month period of time. And we were really concerned with that. And we found out that if we waited for this 6-month period of time, it was more likely that they were going to get lost to care, or they were not going to be getting, come back in for their routine laboratory assessments. And it was difficult for us to monitor or gauge how well they were adhering to their treatment plan. And then we also knew that the treatment plan was not being adhered to because they weren't showing up for their appointments. So what we noticed was we had a gap in care of 17%. And this is based on the HIV/AIDS Bureau performance measure, which is the gap measure. I think it's the core 4 for those of you that work with HAB measures for HIV care and treatment. And what we do is we have a measurement period of 12 months. And like I said, these individuals have a visit within the first 6 months, but they're missing an appointment within the last 6 months. And based on that, 17% of our patients were not receiving that visit within the second half of the 12-month measurement period. We saw that we would get down to about 15%, but we really weren't making a dent in improving that measure. So we felt that it was necessary to really ramp up our strategies, and that's what we did. So we ramped up our strategies, and the ramping up of strategies really was the data analysis piece. That's really what was key in order to identify that there was an issue. And then we've identified that we needed to more frequently look at this data. We couldn't wait until 6 months to when the patient was out of care. We had to start looking at this data, and we started evaluating it monthly. Sometimes doing it more frequently can give you a false impression of whether or not there's a problem because you're looking at it too frequently. But we felt that it was necessary to get a sense for that. And then even though we were looking at it monthly, we were evaluating the quarterly milestones over the 12-month measurement period. And we found that we were just fluctuating between 14 and 15%, and that was our best effort until we started utilizing data to influence finding patients and then getting them in care. Now, the CareWare database allows you to look at persons that are in the numerator or not in the numerator, and this is the advantage to importing your electronic health record information on patients into a software database platform. So we import this information and we run measures, the performance measures that are on the CareWare software platform, specifically the gap measure, and it allows us to generate a client list of those that are in the numerator, meaning that these are the people that are in the gap measure. They have a 6-month gap in their visits. And that allows us to target specific individuals and have our staff work frequently to find these patients and figure out how to get them back in care. Each of these individuals, we do intake assessments because the individual care plans for retention in care and finding patients to get them in care is per person. So everybody is unique, they all have their own set of circumstances, and based on those circumstances is how we identify what strategies will work best for getting those persons in care.